If you're a man over 60, I want you to stop for 1 minute and listen very carefully to this, because there is a truth most older men are never told, not by their doctor, not by their friends, and sometimes not even by themselves. And that truth is this: the silent issues around your prostate, nighttime urination, weak stream, lower abdominal pressure, morning fatigue, are not inevitable parts of aging, and they are absolutely not a sign that your body is past its prime. So what's the truth? Your body still has a powerful ability to recover. You've just been giving it the wrong rhythm, the wrong signals, and the wrong habits. But the best part is this: with just 5 very simple, very natural, and completely free habits, you can transform how your prostate behaves. You can sleep 5-7 hours again without waking up. You can feel a stronger, easier urine flow. You can start your mornings with a lightness you probably haven't felt for a very long time. And even better, these habits are not medications, not surgery, not risky tricks. They are real science proven by major studies from Harvard, Mayo Clinic, and Cleveland Clinic. Today, I'm going to share the exact habits I've taught to thousands of men over 60 inches the past decade. Men who used to wake up 4-5 times a night, struggle with weak flow, fatigue, and years of stress. But after applying these habits correctly, their lives changed drastically within weeks. And make sure you stay until the very end, because the final habit is the one most men ignore, yet it creates the fastest improvement. Before we go deeper into the 5 most important habits, I want you to know who you're listening to. I'm Dr. Emily Carter, a urologist with 14 years of experience working with older men, especially those dealing with prostate issues, pelvic circulation, and natural vitality after 60. I've met thousands of patients across different stages of their lives. Some had just started waking up 1-2 times at night and were already worried. Some endured weak urine flow for 10-15 years, believing all older men are like this. Some silently faced fatigue, insomnia, and loss of confidence, without ever saying a word. And I want to tell you what I tell every single one of my patients. Many prostate-related problems are not caused by age. Age plays a role, yes, but lifestyle, blood circulation, sleep quality, nutrition, and natural release patterns are what decide how fast the prostate enlarges or stays stable. In my practice, I always prioritize natural solutions first, because a man's body after 60 can still recover remarkably well, as long as you send it the right signals. I've seen men at 65, 70, even 78, who simply adjusted 5 small habits, and then slept 6-7 hours again every night, reduced nighttime urination by 50-60%, felt a stronger urine stream, and regained the comfort and ease in their pelvic area they thought was gone forever. And I want that for you starting today. What I share in this video is not a short-term trick, not an advertisement, not a quick fix. This is real science, applied to real life. These are habits proven by medical research and by the experiences of real patients. And now, before we begin this journey together, I want to hear something important from you. Before I share the first habit, I want you to take a few seconds to think about this. Most men after 60 experience the very same issues, waking up many times at night, causing their sleep to be fragmented, their urine stream gradually weakening, making them feel out of control, a tight, uncomfortable pressure in the lower abdomen that they don't know how to talk about, and some days, waking up feeling like their body is no longer theirs. And the sad part is this: so many men go through these problems in silence, not because they're not in pain, not because they're not exhausted, but because they believe they're supposed to just endure it. I want you to know that you are not alone. Thousands of other men are watching videos like this, hoping to find guidance that is safe, natural, easy to follow, and truly effective. And just like them, you can completely change your situation with very small steps, starting today. But before we continue, I want to connect directly with you, the man watching this video. Leave a comment below and tell me, how old are you? And where are you watching this from? I read every single comment, not because of the algorithm, but because seeing men from all over the world taking care of their health together, this is incredibly inspiring. Whether you're in Texas, Florida, California, or watching from Vietnam, Singapore, or Australia, I'm truly glad you're here. And now, let's step into the most important part of this video: the 5 simple habits that can completely transform your prostate health. Before you apply any habit, I want you to understand one important thing. The prostate is not something that breaks down naturally with age. It is a very intelligent organ, and it responds strongly to your daily lifestyle habits. Let me explain it in the simplest way. The prostate is like a soft collar wrapped around your urinary tube. Imagine your bladder as a water balloon. The urethra, where urine comes out, is a small tube, and the prostate is a soft ring of tissue wrapped around that tube. When you're young, that soft collar is flexible and doesn't squeeze the tube. But as you age, several factors make that collar thicker, stiffer, and tighter around the urethra. That's why so many men after 60 begin to experience weak urine flow, difficulty starting urination, not fully emptying the bladder, frequent nighttime urination, or a heavy, tight feeling in the lower abdomen. Why does the prostate enlarge? It's not just age. New science shows that only a small part of the problem comes from aging. The rest comes from 5 lifestyle factors most men overlook. Chronic dehydration. Urine becomes concentrated, and acidic irritates the bladder, causes mild prostate swelling. Poor pelvic circulation. Blood doesn't bring enough oxygen and nutrients. Tissue grows faster. Blood sugar spikes. Increases inflammation. Prostate tissue thickens. The prostate isn't emptied regularly. Fluids accumulate pressure inside, the tissue increases. Poor sleep, melatonin drops, cortisol rises, the body enters an inflamed state, the prostate enlarges more easily. When these 5 factors occur together for many years, the prostate begins to change its structure. That's why men at 60, 70, or 80 often have very similar symptoms, but in most cases, they can be improved. The good news: the prostate responds quickly to the right habits. In my practice, I've seen a 62-year-old reduce nighttime urination by 50% in just 2 weeks, a 70-year-old improve urine flow just by correcting his sleep, a 78-year-old reduce pelvic pressure simply by walking 10 minutes after meals, and many cases where medication wasn't needed immediately. When you change your lifestyle correctly, inflammation decreases, circulation improves, the prostate becomes softer, pressure on the urethra drops, and you begin feeling relief within the first week. That's why the 5 habits I'm about to share have such a powerful impact on the health of most older men. And now, we're going into the most important part. Not medication, not surgery, not risky tricks, but simple, natural habits that can completely change how you feel every time you go to the bathroom and every time you go to sleep. Habit number 1. Deep sleep. The foundation that protects the prostate. In my 14 years of working with older men, there is one thing I've noticed very clearly. Nothing makes the prostate enlarge faster than poor sleep. And conversely, nothing helps the prostate cool down, soften, and reduce inflammation as quickly as restoring deep sleep. In other words, sleep is not time off. Sleep is a form of treatment. What happens to your prostate when you enter deep sleep? When you enter deep sleep, your body activates 2 extremely important hormones: melatonin. This hormone does much more than help you sleep. It also reduces inflammation in the body, protects prostate tissue from oxidative stress, helps the bladder relax and contract less. Melatonin is like a fire extinguisher that calms down the chronic inflammation older men commonly experience. Growth hormone. It may sound like something only young people need, but for men over 60, it's even more important. It repairs damaged cells, restores irritated prostate tissue, reduces tissue thickening that compresses the urethra. When you sleep deeply, your body is healing. But when you sleep poorly, or only lightly, your body never enters this critical recovery stage. What happens if you sleep poorly? This is the part most men don't know. When your sleep is fragmented from nighttime urination, stress, pain, or staying up late, Cortisol increases. Cortisol is the stress hormone. When it stays high, inflammation rises sharply. The body retains more fluid. The prostate swells more easily. Pressure on the urethra increases. Testosterone drops. Low testosterone, weaker pelvic circulation, urinary retention, weak flow, reduced pelvic floor strength. Blood sugar becomes unstable. A poor night of sleep raises blood sugar levels, which leads to inflammation, gradual prostate enlargement over time. The bladder becomes more sensitive. When you lack sleep, your bladder contracts more easily, waking you up, even with very little urine. The result: one bad night equals 1 day of a tired, irritated prostate. Very good news. Sleep can improve faster than you think. Many men believe deep sleep is something they can't get back, but that's completely wrong. When I guide patients through the 4 simple steps below, they often notice improvement within the first week. 4 steps to restore deep sleep for men after 60. Keep your bedroom at 18-20 degrees Celsius, 64-68 degrees Fahrenheit. Cool rooms help the body fall asleep easier. A warm room tension, faster heartbeat, harder to reach deep sleep. Turn off bright screens at least 1 hour before bed. Phones and TVs emit blue light blocks melatonin. You can read a physical book or listen to soft radio instead. Avoid drinking large amounts of water within 2 hours before bed. This reduces nighttime bathroom trips. Well, talk more about hydration in another habit. Avoid coffee and large meals after 5 p.m. Caffeine can stay in the body up to 10 hours at this age. A heavy meal pressure on the bladder, more nighttime urination. A real story: Richard, 74, used to wake up 4 times every night. He said, "I never felt truly rested." We didn't start with medication. I simply asked him to do 3 things: keep his bedroom cool, reduce blue light in the evening, avoid drinking water after 8 p.m. The result? After just 9 days, he was waking up only once per night. And after 3 weeks, there were nights he slept 6 hours straight without waking. He told me, "I feel like my body got a few years younger." That is the true power of deep sleep. Sleep is not a reward at the end of the day. It is the foundation that keeps the prostate healthy, reduces inflammation, decreases nighttime urination, and improves pelvic circulation. If you change just one habit this week, start with your sleep. Habit number 2. Strategic eating for the prostate. Many men don't realize that the prostate reacts strongly to every single item on their plate. A right meal can help the prostate cool down, soften, and become less irritated. A wrong meal can make the tissue swell, become inflamed, and tighten around the urethra faster. I always tell my patients, your daily meals are either medication or inflammation. Through many years of observation, I've seen a very clear pattern. Men who eat red and green foods tend to have healthier prostates, while those who eat a lot of processed meats and fried foods always have worse symptoms. Red foods like tomatoes, watermelon, and pink grapefruit contain lycopene, an antioxidant that slows the thickening of prostate tissue. Cooked tomatoes, soups, sauces are absorbed better than raw ones. Many of my 70-year-old patients say that simply adding tomato soup a few times a week makes their urine flow feel noticeably more comfortable. Another important group is zinc-rich foods. Pumpkin seeds, seafood, nuts. Zinc is like the raw material that helps prostate cells function properly. Zinc deficiency makes the body more inflamed, more tired, and causes a weaker urine stream. A small handful of pumpkin seeds each day or 2 servings of salmon per week is enough to make a real difference. Cruciferous vegetables, broccoli, cauliflower, cabbage, Brussels sprouts help the liver detoxify hormones, reducing male hormonal imbalance, which is one of the drivers of prostate enlargement. Men who eat cruciferous vegetables 4-5 times per week often have more stable PSA levels and less inflammation. I often guide patients to follow the traffic light rule: half a plate of green vegetables, 1/4 lean protein, chicken, fish, beans, 1/4 healthy carbs, sweet potatoes, brown rice, plus a bit of healthy fat like olive oil. This is not a diet, but a way of eating that improves pelvic circulation, reduces inflammation, and decreases pressure on the prostate. But there are also things to avoid: processed meats, fried foods, and sweets. All of them fuel inflammation, thicken the blood, and slow circulation in the lower body. I remember a 72-year-old patient, George, who used a simple approach. The tomato rule: every meal must have something red or green. After 6 weeks, he said his urine flow felt smoother, nighttime urination decreased, and the heaviness in his lower abdomen almost disappeared. If you want a calmer, healthier prostate, start with your plate. Food is the strongest signal you send to your body. Habit number 3. Maintaining natural release in sexual activity. This is a topic many men over 60 feel shy about, sometimes avoiding it entirely. But physiologically, stopping sexual activity for too long, or no longer having natural release, is actually one of the factors that causes prostate congestion, inflammation, and faster enlargement. The prostate is not a passive organ. It is designed to work, produce fluid, and release it regularly. When this natural process stops for weeks or months, the fluid thickens and stagnates. This leads to heaviness in the lower abdomen, weak flow, incomplete emptying, or even mild pain. A 20-year Harvard study of more than 10,000 men found that those who ejaculated regularly, about 21 times per month, had a 33% lower risk of prostate cancer. Not because the number 21 is magical, but because that frequency maintains natural physiological flow. Beyond protecting the prostate, maintaining natural release also helps. Improve pelvic circulation, increase nitric oxide production, reduce stress, improve deep sleep, enhance comfort and emotional connection. What I want to emphasize is this: the goal is not performance, but circulation. No pressure, no comparison to when you were 30. Even gentle, natural, low-stress forms of activity bring clear benefits. I remember a patient, Mark, 67, who had completely stopped sexual activity because he believed older men should avoid it. When he understood the mechanism behind congestion, he slowly returned to a natural rhythm. After just 2 months, the heaviness disappeared, his sleep deepened, and his mind felt clearer. If there is one thing you must remember, the body always needs flow. Natural release is one essential part of that flow. Habit number 4. Walking after every meal. There is a very simple habit that almost all men over 60 overlook. Yet it is one of the habits with the strongest impact on the prostate: taking a light 10-15-minute walk after each meal. It may sound unrelated, but in reality, this is like a form of natural physical therapy, specifically for the prostate. Right after you eat, your blood rushes to the stomach to digest food. This is completely normal, but what most men don't realize is that when blood moves upward to the stomach, the amount of blood flowing to the pelvic region drops sharply. The pelvic region is where the prostate, bladder, and pelvic floor muscles are located. If, after eating, you sit down to watch TV, scroll your phone, or stay in one spot, circulation to the lower region stays low. This makes prostate tissue become stiffer, more easily irritated, and more prone to inflammation. This is one reason many men experience weaker urine flow, heaviness in the lower abdomen, or more frequent nighttime urination. But simply standing up and walking gently changes everything immediately. When you take steps, your leg muscles act like a natural pump, sending oxygen-rich blood down to the pelvic area. Many studies have shown that men who take light walks after meals reduce their risk of nighttime urination, weak flow, and frequent urination by up to 35%. You don't need to walk fast or far. One loop around the yard, around the house, in the park, at the mall, or even walking back and forth in the living room all work. The most important thing is consistency. Walking after meals also helps regulate blood sugar. Stable blood sugar means stable hormones and a calmer, less irritated prostate. I remember a patient named Robert, 71. He used to wake up 3 times every night and always felt heaviness in his lower abdomen. I asked him to do just one thing: walk for 10 minutes after dinner. After 2 weeks, he reduced it to just one nighttime bathroom trip. He said, "I didn't expect a few steps to make such a big difference. If you want to start with the easiest habit, no equipment, no effort, no heavy exercise, start with this. Walk after every meal. Your body will thank you with every step." Habit number 5, strategic hydration, right timing, not chugging. The last habit is also the one most commonly done wrong: the way you drink water. It's not the amount that matters, it's the timing and rhythm. Many men drink very little water throughout the day, then drink 2 or 3 full glasses at night when they suddenly feel thirsty. This is a classic mistake. And the result? They wake up 3-4 times at night, sleep poorly, feel exhausted, and the prostate becomes more irritated. When the body is dehydrated for several hours, urine becomes concentrated and more acidic. This type of urine directly irritates the bladder lining and prostate tissue. If this happens repeatedly throughout the day, the tissue thickens and swells slightly, causing weak flow, difficulty urinating, or incomplete emptying. But the very good news is, simply adjusting your hydration rhythm can reduce nighttime urination by up to 40%, according to the Journal of Urology. The principle is very simple. 1. Drink consistently. Don't chug. Steady hydration keeps the body balanced without overloading the bladder. 2. Drink 1 glass of water right after waking up. This first glass wakes up the kidneys, flushes toxins, and reduces the acidity that builds up overnight. During the day, drink half a glass every 30-45 minutes. You don't need much, just gentle sipping. 4. Stop drinking large amounts of water 2 hours before bed. This is the key to reducing nighttime urination. If you drink coffee, soda, tea, or alcohol, drink an extra half glass of water afterward. All of these cause dehydration and make the blood thicker, slowing pelvic circulation. I remember another patient, Alan, 68. He had been waking up 4-5 times every night for years. When I adjusted his hydration pattern, steady water intake during the day, reduced intake at night after just 3 weeks, he only woke up once. He said he felt younger, lighter, and slept far more deeply. If you change just one simple thing, change the way you drink water, drink at the right times, drink steadily, and your prostate will function more smoothly every single day. Now, before we move into the final summary, I want to hear your voice, the man watching this video right now. I can share dozens of studies and hundreds of real-life cases, but it is your story that can inspire another man who is struggling with the same challenges you are facing. So I want you to take a few seconds to answer 2 very important questions. Out of the 5 habits I just shared, which one do you think you're missing the most? Is it deep sleep? Is it healthier eating? Have you gone too long without sexual activity? Or have you never tried walking after dinner? Or maybe you're someone who tends to drink most of your water at the end of the day. Just one small change can create a big difference. And the second question, which habit will you start today? I truly want to know that. Every comment you leave can help another man realize that he is not alone on this journey. If you've experienced improvements, or if you're still worried about something, please share it. Thousands of men from all around the world read the comments, and sometimes just one sentence from you can bring hope and direction to someone else after 60. I read every comment, not because of the algorithm, but because I genuinely want to understand what you're going through, and I want to walk alongside you for the long term. Before we end today, I want you to take a moment to truly reflect on your own journey. After 60, the body changes, that's true. But the more important truth is this: you still have tremendous ability to recover, to regain strength, and to live with the confidence and control you deserve. The 5 habits I shared are not magic. They are gentle signals you send to your body every day, signals that say, I still care about my health, I still want to feel better. And when your body receives those signals, it responds faster than you think. You don't need to change everything in one day. Just one small step, one new habit, one simple decision. From there, comfort will come. Your urine flow will become stronger. Your sleep will deepen. The heaviness in your lower abdomen will slowly disappear. And most importantly, you will feel your confidence, your comfort, and your sense of control returning. I believe in that. And I believe in you. If the insights I shared today helped you understand your body better, or gave you a sense of relief knowing that your health can improve at any age, then I'm truly glad to have been able to walk this journey with you. And if you want to keep receiving videos like this simple, natural, science-based guidance made specifically for men over 60, you can hit like or subscribe so we don't lose each other. Not because of the algorithm, but because I genuinely want to continue supporting you on this journey. Before you leave, I also want to remind you of something important. This video is for educational and informational purposes only. It is not a substitute for medical diagnosis or professional health advice. Every person's body is different. If you have pain, burning during urination, sudden changes in your urine flow, or any other concerns, please speak directly with your urologist. Thank you for spending your time here today. Keep taking care of your health one day at a time. And I'll see you in the next video.